Welcome to today's video about symptoms of gluten intolerance. Have you ever felt like your body is sending you signals that something isn't quite right, but you can't pinpoint what it is? Maybe you've been experiencing persistent fatigue, unexplained headaches, or that frustrating mental cloudiness that just won't lift. You've probably dismissed these symptoms as stress, aging, or just part of modern life. But what if I told you that up to 10% of the population might be suffering from a condition that's hiding in plain sight? Today, we're diving deep into the mysterious world of gluten intolerance, not the celiac disease you've heard about, but something far more subtle and equally disruptive. We're talking about 14 hidden symptoms that most people completely overlook, symptoms that could be silently sabotaging your health right now. These aren't your typical stomach problems. In fact, many of these symptoms occur nowhere near your digestive system, which is exactly why they're so easy to miss. Recent research has revealed that gluten sensitivity affects between 0.5 to 6% of the population, and the symptoms extend far beyond what doctors traditionally looked for. By the end of this video, you'll understand why that persistent brain fog might not be from lack of sleep, why your joint pain might not be from aging, and why your mood swings might have more to do with your breakfast than your circumstances. Now let's go through the symptoms one by one, starting with the first. Brain fog. Let's start with something that affects millions of people daily, but rarely gets connected to diet. Brain fog. Picture this. You're sitting at your desk, trying to focus on an important task, but it feels like you're thinking through thick cotton. Your thoughts feel sluggish, your memory seems unreliable, and concentrating becomes an exhausting battle. Research has established a fascinating connection between gluten consumption and cognitive dysfunction in sensitive individuals. When people with non-celiac gluten sensitivity consume gluten-containing foods, their immune system launches an inflammatory response that travels throughout the body, including the brain, disrupting normal neurotransmitter function and creating that frustrating mental haze. What makes this particularly insidious is the timing. Brain fog from gluten intolerance doesn't necessarily occur immediately after eating. It can develop gradually over hours or even days, making the connection nearly impossible to identify without systematic elimination. Studies show that gluten-sensitive individuals who adopt a strict gluten-free diet often experience dramatic improvements in mental clarity within weeks, as inflammation subsides and neurotransmitter balance is restored. Next, symptom 2. Chronic fatigue. Now let's talk about chronic, unexplained fatigue. Not the normal tiredness after a long day, but that bone-deep exhaustion that persists even after adequate rest. Many people suffering from gluten intolerance describe feeling like they're constantly running on empty, no matter how much they sleep. When gluten-sensitive individuals consume wheat, barley, or rye, their immune system treats gluten proteins as foreign invaders, mounting an inflammatory response. This chronic low-grade inflammation is like having your body's alarm system constantly activated, draining energy resources that should be available for normal daily activities. Additionally, the inflammatory process can interfere with nutrient absorption in the small intestine, leading to deficiencies in crucial energy-producing vitamins and minerals. Research demonstrates that this isn't just psychological fatigue, it's a measurable physiological response. Studies show elevated levels of inflammatory cytokines in gluten-sensitive individuals after gluten consumption. What's particularly revealing is that when these individuals eliminate gluten from their diets, both the inflammatory markers and the fatigue symptoms typically improve within several weeks. Next, symptom 3. Headaches and migraines. Headaches are so common that most people consider them a normal part of life. But what if your recurring headaches or debilitating migraines are actually your body's way of protesting against gluten? Recent neurological research has uncovered compelling connections between gluten sensitivity and various types of head pain. The relationship between gluten and headaches involves several interconnected mechanisms. Gluten-induced inflammation can affect blood vessels in the brain, triggering vascular headaches and migraines. Additionally, gluten sensitivity can disrupt serotonin production and regulation, serotonin being a crucial neurotransmitter involved in pain perception and mood regulation. Clinical studies have shown that individuals with non-celiac gluten sensitivity experience headaches at significantly higher rates than the general population. Even more compelling is research demonstrating that gluten-sensitive headache sufferers often experience substantial improvement when following a strict gluten-free diet. In many cases, headaches that had been present for years began to diminish within months of gluten elimination. Next, Symptom 4. Anxiety and depression. Mental health struggles are often viewed through psychological lenses, but emerging research reveals that gluten consumption might be playing a more significant role in anxiety and depression than previously recognized. The gut-brain axis, a complex communication network between our digestive system and brain, can be severely disrupted by gluten intolerance. Gluten sensitivity triggers chronic inflammation that extends beyond the digestive tract, reaching the brain and affecting neurotransmitter production. Serotonin, often called the happiness hormone, is primarily produced in the gut. When gluten-induced inflammation damages the intestinal lining, serotonin production can be significantly impaired, affecting mood, sleep patterns, and emotional stability. Research has documented cases where individuals with treatment-resistant depression and anxiety experienced remarkable improvements after adopting gluten-free diets. The inflammatory cytokines produced in response to gluten can cross the blood-brain barrier, directly affecting brain regions responsible for mood regulation. Studies show that gluten-sensitive individuals following strict gluten-free diets often experience significant improvements in anxiety levels and depressive symptoms within several months. Next, Symptom 5. Skin problems. Your skin often serves as a window into internal health issues. For many people with gluten intolerance, skin problems become the most visible manifestation of their sensitivity, appearing as persistent rashes, eczema flares, or those mysterious small bumps known as keratosis pilaris. These skin issues are frequently dismissed as genetic conditions when they might actually be inflammatory responses to dietary gluten. Gluten-induced inflammation can trigger autoimmune responses that target skin tissues, leading to various dermatological conditions. Additionally, chronic inflammation disrupts the skin's natural barrier function, making it more susceptible to irritation and infection. The inflammatory process also affects collagen production and skin cell turnover. Clinical observations have documented significant improvements in various skin conditions when gluten-sensitive individuals eliminate gluten from their diets. Eczema patches that had persisted for years often begin clearing within weeks. Those rough, sandpaper-like bumps on the arms and thighs frequently smooth out as inflammation subsides. Even subtle skin issues like persistent dryness or slow wound healing can improve dramatically. Next, Symptom 6. Hair loss. Hair loss is often attributed to genetics or aging, but for many people with gluten intolerance, thinning hair might be a direct result of chronic inflammation and nutrient malabsorption. When gluten triggers chronic inflammation in sensitive individuals, the inflammatory process can damage the intestinal villi responsible for nutrient absorption, leading to malabsorption of crucial nutrients needed for healthy hair growth. Research has identified specific patterns of hair loss associated with gluten sensitivity, including diffuse thinning across the scalp and alopecia areata, patchy hair loss that can occur anywhere on the body. Hair loss typically occurs months after the initial inflammatory damage, making the dietary connection nearly impossible to identify without careful investigation. However, studies have shown encouraging results for individuals who eliminate gluten and address nutritional deficiencies. Hair regrowth often begins within several months of adopting a strict gluten-free diet, as inflammation subsides and nutrient absorption improves. The follicles that appeared dormant often begin producing healthy hair again once the underlying inflammatory triggers are removed. Next, Symptom 7. Mouth ulcers. Recurring mouth ulcers or canker sores are among the most painful symptoms of gluten intolerance, yet they're rarely connected to dietary triggers. These small but agonizing lesions can make eating, drinking, and speaking uncomfortable for days or weeks at a time. The development of mouth ulcers in gluten-sensitive individuals involves direct inflammatory responses in the oral tissues. When gluten proteins come into contact with the mouth and digestive tract, they can trigger localized immune responses that damage the delicate mucous membranes, creating painful ulcerations that heal slowly due to ongoing exposure. Research has documented significantly higher rates of recurrent mouth ulcers in individuals with gluten sensitivity compared to the general population. Studies show that gluten-sensitive individuals who adopt strict gluten-free diets often experience substantial reductions in both the frequency and severity of mouth ulcers within weeks to months, as the inflammatory process subsides. Next, Symptom 8. Joint and muscle pain. Joint and muscle pain are commonly dismissed symptoms of gluten intolerance, often attributed to aging or stress. Many people suffering from gluten-related inflammation experience arthritis-like symptoms that can affect multiple joints simultaneously, creating patterns of pain that seem to move throughout the body without clear triggers. The inflammatory response triggered by gluten consumption becomes systemic, affecting tissues throughout the body including joints, muscles, and connective tissues. This inflammation can cause joint stiffness, muscle aches, and pain that's often described as similar to arthritis or fibromyalgia. The inflammatory cytokines produced in response to gluten can directly affect joint tissues. Unlike arthritis caused by wear and tear, gluten-related joint pain often improves dramatically once the inflammatory trigger is removed. Studies show that many people with non-celiac gluten sensitivity who experience joint pain see substantial improvements within several months of adopting a gluten-free diet as inflammation subsides and joint mobility improves. Next, Symptom 9. Tingling or numbness. Neurological symptoms like tingling, numbness, or pins and needles sensations are concerning manifestations of gluten intolerance, often affecting the hands, feet, arms, or legs. This condition, known as peripheral neuropathy, occurs when the inflammatory response triggered by gluten damages the peripheral nervous system. The mechanism involves both direct inflammatory damage to nerve tissues and indirect effects through nutrient malabsorption. Chronic inflammation can damage the protective myelin sheaths surrounding nerves, disrupting normal nerve signal transmission. Additionally, malabsorption of crucial nutrients like B vitamins can contribute to nerve damage and dysfunction. Clinical studies have identified peripheral neuropathy as a significant manifestation of gluten sensitivity. The tingling and numbness typically start in the extremities and can progress if gluten consumption continues. However, research shows encouraging results for individuals who eliminate gluten and address nutritional deficiencies, with nerve function often beginning to improve within months. Next, Symptom 10. Iron deficiency. Anemia. Iron deficiency anemia in adults, especially when it occurs without obvious blood loss, often puzzles healthcare providers. Many people with gluten intolerance develop persistent anemia that doesn't respond well to iron supplementation alone because the underlying cause, impaired iron absorption due to intestinal inflammation, remains unaddressed. When gluten triggers inflammation in the small intestine, it damages the intestinal villi responsible for nutrient absorption. Iron absorption occurs primarily in the duodenum, making it particularly vulnerable to gluten-induced damage. Even individuals who consume adequate dietary iron may remain anemic because their inflamed intestines cannot effectively absorb the iron. Research has documented that iron deficiency anemia can be the first manifestation of gluten sensitivity in some individuals. Studies show that gluten-sensitive individuals with iron deficiency anemia often experience significant improvements in their iron status within months of adopting a strict gluten-free diet, as intestinal inflammation subsides and iron absorption capacity is restored. Next, symptom 11. Bloating and gas. Digestive symptoms like bloating and gas are among the most common manifestations of gluten intolerance, yet they're often the most dismissed. Many people accept frequent bloating and gas as normal parts of digestion without recognizing that healthy digestion shouldn't consistently produce these uncomfortable symptoms. When gluten-sensitive individuals consume gluten-containing foods, the inflammatory response in the small intestine disrupts normal digestive processes. The inflammation can slow gastric emptying, alter gut bacteria composition, and increase intestinal permeability, creating an environment where food ferments abnormally, producing excess gas and uncomfortable distension. The pattern of gluten-related bloating is often distinctive. It typically occurs within hours of consuming gluten-containing meals and can persist for days. Research shows that individuals with non-celiac gluten sensitivity who eliminate gluten often experience dramatic improvements in bloating and gas production within weeks, as intestinal inflammation subsides and normal digestive processes resume. Next, symptom 12. Irregular menstrual cycles. Reproductive health issues, particularly irregular menstrual cycles, are increasingly being connected to gluten intolerance through complex interactions between inflammation, hormone production, and nutrient absorption. Many women with gluten sensitivity experience menstrual irregularities that are often attributed to stress or hormonal imbalances without investigating potential dietary triggers. Gluten-induced inflammation can affect hormone production through multiple pathways. Chronic inflammation disrupts the hypothalamic pituitary gonadal axis, which controls reproductive hormone production. Additionally, malabsorption of nutrients crucial for hormone synthesis can further contribute to hormonal imbalances. Research has documented connections between gluten sensitivity and various menstrual irregularities. Studies show that women with gluten sensitivity who adopt gluten-free diets often experience improvements in menstrual regularity within several months, as the inflammatory burden decreases and hormonal balance begins to restore. Next, symptom 13. Poor bone health. Bone health issues, including osteoporosis and frequent fractures, can be hidden consequences of long-term gluten intolerance that often go unrecognized until significant damage has occurred. When gluten triggers intestinal inflammation in sensitive individuals, the damaged intestinal villi cannot effectively absorb calcium, vitamin D, magnesium, and other nutrients essential for bone health. Studies show that individuals with untreated gluten sensitivity often have lower bone density than expected for their age and gender. This bone loss can occur silently over years, making the connection to gluten difficult to identify until fractures occur or bone density tests reveal problems. However, research demonstrates that individuals with gluten sensitivity who adopt strict gluten-free diets often experience improvements in bone health markers within months to years. Intestinal healing allows improved nutrient absorption, inflammation decreases, and normal bone remodeling processes can resume with early identification and intervention. Next, symptom 14. Autoimmune flares. Perhaps the most serious hidden consequence of undiagnosed gluten intolerance is its potential to trigger or exacerbate autoimmune conditions. Research has revealed strong associations between gluten sensitivity and various autoimmune disorders, including thyroid disease, type 1 diabetes, and rheumatoid arthritis. The molecular structure of gluten proteins shares similarities with certain human tissue proteins. When the immune system produces antibodies against gluten, these antibodies can cross-react with human tissues that have similar molecular structures, leading to autoimmune attacks. Additionally, chronic intestinal inflammation can increase intestinal permeability, allowing larger molecules to enter the bloodstream and potentially trigger immune responses. Research documents that individuals with autoimmune conditions have significantly higher rates of gluten sensitivity compared to the general population. Studies show that some people with autoimmune conditions experience improvements in their symptoms when they eliminate gluten from their diets, as the inflammatory burden decreases and triggers for autoimmune activity are reduced. We've just explored 14 hidden symptoms of gluten intolerance that millions of people experience daily without making the connection to their diet. From brain fog and chronic fatigue to autoimmune flares and bone health issues, these symptoms represent just how far-reaching the effects of gluten sensitivity can be throughout the body. What makes this information so crucial is that between 0.5 to 6% of the population may be suffering from non-celiac gluten sensitivity without realizing it. Unlike celiac disease, which has clear diagnostic markers, gluten sensitivity can be much more subtle and difficult to identify. The symptoms we've discussed today often develop gradually and can be easily attributed to stress, aging, or other health conditions. The key insight is that many of these symptoms occur outside the digestive system, which is why the connection to gluten is often missed. Your headaches, joint pain, skin problems, or mood issues might not seem related to what you ate for breakfast, but the inflammatory processes triggered by gluten can affect virtually every system in your body. If you recognized yourself in several of these symptoms, it might be worth discussing gluten sensitivity with your healthcare provider or considering a carefully supervised elimination diet. Remember, this isn't about following the latest dietary trend. It's about understanding your body's unique responses and making informed decisions about your health. The research continues to evolve, and our understanding of gluten sensitivity keeps expanding. What we know for certain is that for those who are sensitive, eliminating gluten can be life-changing, often providing relief from symptoms that have persisted for years. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Don't forget to like this video if it provided valuable insights, share it with anyone who might benefit from this information, and subscribe to our channel for more evidence-based health content. Thank you for taking the time to learn about your health. And remember, you know your body better than anyone else. Trust your instincts and don't dismiss persistent symptoms as just normal.